Alopecia areata is a condition where your immune system attacks your hair follicles. It can come out of nowhere, and it attacks usually after something irritates the immune system, but most of the time for no obvious reason. The typical presentation is when someone loses patches of hair on different parts of their scalp. Occasionally, and very unfortunately, people can go completely bald and lose all of the hair on their head and body, and oftentimes are otherwise healthy. So the three types of alopecia areata are typical alopecia areata, where you lose patches of hair. There's alopecia totalis, where you lose all of the hair on your scalp. And then there's alopecia universalis, where you lose every hair on your body. And there are different degrees of severity, and they're slightly different in the way your immune system is behaving. And usually you stay in your lane. When you develop alopecia areata and you don't progress to universalis, oftentimes you stay as a typical alopecia areata patient. If you develop alopecia universalis, it's unlikely that in the future, after regrowth, your condition would be less severe and you would only get alopecia areata. It's one of the more alarming physical autoimmune conditions because you feel fine and then your hair is rapidly falling out. So most of the time, there's no other symptoms at all. Even though it's hair loss, it's incredibly traumatizing to have your appearance change without your consent. It has a huge mental health effect on my patients. It's profound. If you have a family history of autoimmune disease, particularly vitiligo, celiac, type 1 diabetes, different things within that category of autoimmune diseases, then you have a higher chance of yourself having an autoimmune disease, but there are not necessarily risk factors that you can control. There's a lot of good treatment now. The most important class of treatment that we have now is JAK inhibitors, and we can give them both orally and topically. The benefit to alopecia areata, unlike other autoimmune diseases, is we can see it. So a lot of people worry about immunosuppression and being oversuppressed, but we have the luxury of seeing the hair regrow, so we can lower the dose when someone does really well. I often put people on much lower maintenance doses. It's rare in that we know exactly how we're treating you and how you're responding. So people do great, and the side effect profile has been wonderful.